Typical illnesses that women may experience. Breast cancer. Breast cancer is the most common cancer among women worldwide. Regular breast self-examinations, clinical breast exams, and mammograms are important for early detection. Osteoporosis. This condition involves the loss of bone density, making bones more fragile and increasing the risk of fractures. Women are particularly susceptible to osteoporosis, especially after menopause. Polycystic ovary syndrome, PCOS. PCOS is a hormonal disorder that affects women of reproductive age. It can cause irregular periods, excess hair growth, acne, and small cysts on the ovaries. Urinary tract infections, UTIs. UTIs are more common in women due to the shorter urethra. Symptoms include a frequent urge to urinate, pain or burning during urination, and cloudy urine. Endometriosis. Endometriosis occurs when the tissue that lines the uterus grows outside the uterus, leading to pain-heavy periods and fertility issues. It can also cause pelvic pain during menstruation. Depression and anxiety. Mental health conditions such as depression and anxiety are more prevalent in women. Hormonal changes, life events, and social factors contribute to this higher risk. Autoimmune diseases. Conditions like rheumatoid arthritis, lupus, and multiple sclerosis are more common in women. Autoimmune diseases occur when the immune system mistakenly attacks healthy tissues. Thyroid disorders. Women are more prone to thyroid disorders, including hypothyroidism, underactive thyroid, and hyperthyroidism, overactive thyroid. Symptoms may include fatigue, weight changes, and mood swings. Migraines. Migraines are severe headaches often accompanied by nausea, light sensitivity, and visual disturbances. Women are 3 times more likely to experience migraines than men, which may be influenced by hormonal factors. Heart disease. Although heart disease is often associated with men, it is a leading cause of death for women too. Risk factors include high blood pressure, high cholesterol, obesity, and smoking. Cervical cancer. Cervical cancer is a type of cancer that develops in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. Uterine fibroids. Uterine fibroids, also known as leiomyomas, are non-cancerous growths that develop in the muscular wall of the uterus. Premenstrual syndrome, PMS. Premenstrual syndrome, PMS, refers to a set of physical, emotional, and behavioral symptoms that occur in the days or weeks before a woman's menstrual period. PMS is quite common, affecting a significant number of women during their reproductive years. Menopause symptoms. Menopause is a natural biological process that marks the end of a woman's reproductive years. Pelvic inflammatory disease, PID. Pelvic inflammatory disease, PID, is an infection that affects the female reproductive organs, particularly the uterus, fallopian tubes, and ovaries. Gestational diabetes. Gestational diabetes mellitus, GDM, is a form of diabetes that occurs during pregnancy and usually resolves after childbirth. Ovarian cancer. Ovarian cancer is a type of cancer that develops in the ovaries, which are the reproductive organs that produce eggs in women. Iron deficiency anemia. Iron deficiency anemia is a common type of anemia characterized by a deficiency of iron in the body or a decrease in the amount of hemoglobin in the blood. Eating disorders. Eating disorders are serious mental health conditions characterized by abnormal and unhealthy eating behaviors. Sexually transmitted infections, STIs. Sexually transmitted infections, STIs, also referred to as sexually transmitted diseases, STDs, are infections transmitted through sexual activity. Stroke. A stroke, also known as a cerebrovascular accident, CVA, occurs when the blood supply to a part of the brain is interrupted or reduced, resulting in the death of brain cells. Anxiety disorders. Anxiety disorders are a group of mental health conditions characterized by excessive and persistent feelings of fear, worry, and anxiety that significantly impact a person's daily life. Pelvic pain disorders. Pelvic pain disorders refer to a group of conditions that cause persistent or recurrent pain in the pelvic region, which is the area between the belly button and the hips. Chronic pelvic inflammatory disease, CPID. Chronic pelvic inflammatory disease, CPID, is a long-term inflammation of the female reproductive organs, including the uterus, fallopian tubes, and ovaries. Conclusion. In conclusion, women may experience a range of typical illnesses that are specific to their reproductive system, hormonal changes, and overall health. These conditions can have significant physical, emotional, and social impacts on women's lives. It is important for women to be aware of these illnesses, seek regular healthcare checkups, and consult with healthcare professionals for proper diagnosis, treatment, and management of any symptoms or concerns. Early detection, timely intervention, and appropriate care are key to maintaining women's health and well-being. Medical information disclaimer. This video contains general medical information. The information in this video is only for educational purposes. The medical information is not advice and should not be treated as such. You must not rely on the information in our videos as an alternative to medical advice from your doctor or other professional healthcare provider. My channel Health Tips by G provides valuable information on how to stay healthy and fit. You can learn about the latest health trends and tips to help you stay healthy. Health Tips by G is the perfect resource for anyone looking to improve their overall health and well-being.